Good afternoon. We are here at Cebu Mariculture Center and Maternity House Incorporated, which is a secondary hospital. So we are heading to the chief nurse office to interview her. We are going to interview the head nurse, Miss Elena Homoan, and the RN. Here it is. So, give her a
Kasi, ayun na natay video. Yun na natay video pa di siya makain.
Ma'am, namin video, ma'am. Mag-video mo.
Hello, good afternoon. Good afternoon, ma'am.
Ma'am.
This is like
Sumuka.
Ako mo mag-take the Tell me when you're ready, ma'am.
Da.
Good afternoon.
Okay, so we are the group 2 from Palas College, ma'am. Then we are here to report how to interview you about the secondary hospital, which is this Cebu
Culture Center.
Yeah. Okay, so the first question is, what are the objectives or goals of the health agency?
Cebu Culture Center and Maternity House Incorporated was founded in 1922, and we are on our 90th years of delivering health services to our mothers and newborns. Our facility was issued a license to operate as a special secondary hospital by the Department of Health. Its goals, specific goals, are to guide mothers throughout pregnancy and towards safe delivery, and also to attend the health needs of our newborn baby.
Okay, ma'am. Thank you. And what are the existing policies or thrust or strategies in order to meet its goals or objectives?
In order to guide our mothers throughout their pregnancy, we want them to have their prenatal in our outpatient department so that we can monitor them with regards to complications during pregnancy, and that it can be treated immediately. And one of our strategic approach is, if they have their prenatal in our OPD, we let them avail of our package deal. Yes, they can avail of our package deal, especially those pregnant mothers belonging to the low socioeconomic status, so that they can avail of the lowest cost possible hospitalization once they delivered in our facility. And our thrust is to provide and ensure quality OB/GYN services, thereby lessen maternal and newborn mortality and morbidity rate.
Okay, so follow-up question, ma'am. How about the prenatal scheduling, ma'am? Do patients come by kuan?
No, they have to
Appointment.
by appointments. For the new first-timer, they have to come a day before so that they can be arranged where to schedule their prenatal. Because we have our prenatals from Monday to Friday, Monday to Saturday, except Thursday. Thursday is well-baby clinic and immunization. And we have 3 days we classify our prenatal patients into 2. One is for the normal, meaning pregnancy without any complications. Then the other one is, we call it as high risk, meaning those pregnant mothers having complications belonging to the high risk high risk, which is high blood, cesarean, previous cesarean section, and also any pregnant mothers having complications. We consider them belonging to the high risk.
High risk.
Okay. So with regard to the organizational structure, how is the flow of functions and responsibilities of the healthcare system of your agency?
Our facility is headed by the medical director. She oversees and manages the total overall management of the hospital, and she supervises the resident doctors with regards to the treatment of the patient. So our medical director directs the operational of the hospital with regards to the delivery of services to our clients. And likewise, the nursing service, which comprises the staff nurses, the staff midwives, and which is headed by yours truly. I manage the nursing service with regards to the delivery of nursing care to our patients. So hand in hand, we coordinate with each other in the delivery of health services to our clients.
Okay, so with regards to illnesses to ma'am, what are the most reported illnesses experienced with the people in your catchment area?
Our catchment area are all pregnant mothers.
Okay.
Considering that we are delivering services for pregnant mothers. So far, the illnesses we have on record are those complications during pregnancies. And the leading are the urinary tract infections, then followed by the urinary tract infection, which needs immediate treatment so that there will be no complications, or the first complications is the pregnancy uterine contraction, premature uterine contraction, which causes abortion or early delivery because of urinary tract infection. Another one is hypertension, which is pregnancy-induced hypertension. The hypertension is caused by the pregnancy. So we treated that immediately because that can cause eclampsia to the patient. So far, that's the two leading illnesses on record in our outpatient.
And about what are the common causes of death in your catchment area too?
We don't have record for deaths of mothers or pregnant mothers. What we have are the newborn deaths. The newborn deaths. Sometimes it is due to prematurity. Yes, prematurity, severe prematurity, and extreme prematurity, wherein the baby is not viable to live. Really can, because of immaturity, the lungs not yet developed, the heart is not yet developed. Mostly it's more on prematurity with congenital anomalies. Sometimes there are anencephaly without the skull, then cleft lip and palate. Just recently we had this it's just the scrotum without the penis. So the baby live for 24 hours. Mostly of the causes of our mortality for newborns are congenital anomalies.
So in response to the health problems affecting the community residents, what are the
Considering that we are delivering health services for pregnant mothers and babies, what we have is the information dissemination in our OPD with regards to proper nutrition during the pregnancy, then the regular clinical checkup to monitor complications. And for our newborn, we have this immunization. Then we're encouraging mothers to breastfeed their newborn so that the baby can have antibodies coming from the milk, which is the colostrum, and it can help fight against any microorganisms in the baby, so the baby may live. Another one is, of course, we're incorporating the family planning. early detection of diseases themselves so that they can bring treatment. It's one is to two. With our renovations, expansion, and we foresee some new equipment. It's one is to one as of today.
Okay, ma'am. So, with regards to kanang problems, ma'am, how do you solve the issue of lack of health personnel and healthcare facilities?
We have not experienced it as of today because we have sufficient manpower. Nurses, we have staff nurses, enough staff nurses, and enough staff midwife. We experienced that before. What we did is we let the staff nurses, we let them go on 12 hours duty, like 7/7.
Okay.
But they are paid for overtime, the 4 hours. And our medtech in our laboratories, we have a shortage of medtech. So we utilize, we hired a nurse phlebotomist. So the nurse phlebotomist goes to the ward and to the LR, DR, OR to get blood samples, and the medtech stays in the laboratory to perform the procedures. So at least the nurse phlebotomist is able to help during that time when we have shortage of medtechs. But as of today, we have enough medtechs already.
So, your phlebotomist or medtechs already?
No,
Nurse
phlebotomists. They perform the extraction of blood only, not
Okay.
the examination of the procedures. It's only on the extraction of blood. So at least the medtech stays in the laboratory and do the procedures, the tests. And nurse phlebotomist goes around to get the bloods, and in the labor room, since the IV insertion start in the labor room, during the time that the nurse there in the labor room do the IV insertion, if there is an order of blood chemistry like CBC, they already get the sample and send it to the medtech. They have the test tube, vial tube.
Okay. So, I think that's all, ma'am. So, thank you.
Thank you so much.
Thank you so much, ma'am.
You're welcome.
Thank you so much. Thank you.
Ano, mag-picture.
Sige, sige, ma'am.